Hey team, I hope that you all are doing well. We have really been transitioning over here at Rogers right now. We're moving into the telemedicine space, and so I wanted to make a series of videos for you all going over some of the procedures that we'll be using for telehealth. I'm going to take my time in these videos, make sure that I hit the point, so you can pause this video also at any time and read the document as it scrolls through your screen. Eventually, I will get you also a copy of these once they're pulled off and approved. I cannot imagine anything regarding these policies and procedures drastically changing that it would severely change your workflow at all. So feel free to always come back to this video series to take a look around how to do things, and as always, ask me any questions that you may have around these procedures. So there are 12 different procedures that we're going to cover in this video series, and those are right here. So patient identification process, the minimum technological criteria, minimum financial criteria, the PCR patient registration check-in and check-out procedures, the DocuSign recipients' roles, adjusting DocuSign recipients for minor and adults with guardians, the suicidality criteria and procedure, vitals and medication/allergy reconciliation procedures, prescription procedures, documentation procedures, billing and coding, and then finally the internal and external interpreter procedures. So we're going to have a different video for each one of these, going into depth about it, jumping between Athena Health and Doxy.me and DocuSign, so you can see how everything works with this, with these procedures. So let's go ahead and jump into our first one, which is the patient identification process. So the patient identification process really, it is a procedure, but it's not one that you're going to be doing day in and day out in terms of a workflow. It's more of a keep this on your mind kind of procedure as we begin to grow this telemedicine practice. So this helps us identify the manners in which we're going to locate patients who may be good telemedicine candidates. So in doing this, we're going to be utilizing our electronic health record. We can send out emails to patients announcing and promoting that we now have telemental health and telehealth services in general. Of course, we're going to be asking patients through a call to action to respond to those emails, because we also want to identify what patients are monitoring their email but are also willing to engage. Those individuals are likely more able to be better telehealth participants. And of course, we're going to reach out with direct mail and social media campaigns as needed. That'll be part of the marketing initiative, the marketing team's efforts. PCRs, during their day-to-day process, can screen inbound and outbound phone calls for eligibility. So while on the phone, the PCRs will be able to ask patients regarding their interest in mental health services, and also being able to evaluate those minimum technological and financial criteria over the phone to see if they are indeed a good candidate. Patients may also be eligible upon identification that they have an email and an address inside of Athena, right? This will also be handled too, because when we're sending out those emails, we should be able to get responses back. However, just opening a client's chart, going to the quick view, and seeing that they have both of those spots filled out, and we know they're not already on or not already a telehealth patient, they may thus be potential participants. And existing patients, as they meet with the providers. So if you are a provider and you're meeting face-to-face, you may want to mention that we now have telemental health services. And if you know they're not a participant currently, you can also ask questions regarding their financial eligibility and also the technological capabilities that they have, because we can identify new telemental health patients that way. And of course, if your provider also uses clinical judgment, we'll get more into this in some of our other procedures, but not every patient, regardless of their financial technological capabilities, will be a good fit for any telehealth services. Another way for us to identify patients is to run a report for patients that have paid with a credit or debit card. Those patients will meet the minimum financial criteria, because we need to be able to take payments for co-pays and likewise over the phone. So running a report of those patients who have paid using that method, then we can then reach out to them, see if they have an email, meet the other criteria, and if they're interested, they may thus be a good fit for telehealth or telemental health. Okay, so we're going to go ahead and jump into our next video around minimum technological criteria for telehealth services.